Welcome back to DBL. Christina Applegate and Lynn Sigler spoke to Robin Roberts about their very different experiences with multiple sclerosis. So we've got Dr. Coley here to talk about MS and the effects and how it affects people differently. But first, let's hear what Christina had to say.
I live kind of in hell. I'm not out a lot, so this is like a little difficult just for my system. But yeah, of course, the support is wonderful, and I'm really grateful.
We also saw actress Selma Blair at the Vanity Fair Oscars party with her cane looking amazing. So Dr. Coley, why is it that these women have very different presenting symptoms, different experiences when they all have the same diagnosis?
Yeah, so multiple sclerosis, a diagnosis where our immune system attacks our nerves, can look very different for everyone. In fact, every person is thought to have a different course of multiple sclerosis, and it all depends on which nerves the immune system decides to attack. So some people can have visual symptoms, some people can have trouble with walking, some people can have incontinence. It all depends on the nerves. It depends on how severely those nerves get attacked and damaged and how they recover. So your course can either look like this, where you just keep getting worse and worse because you keep attacking those same nerves, or it can look kind of more like peaks and troughs, where you have episodes where you recover, you feel fine, you're able to do the things you need to do, and then you have flares again. So that's part of it. Part of it is also how every woman's immune system is a little bit different. How they respond to treatments is different. So some people, when you give them treatments, it modifies the course of the disease, whereas for others, it just keeps progressing.
So, okay, so talk to me about what the treatment is for MS, and is there a cure? I know we're also dealing with like Alzheimer's, we're getting closer. Parkinson's, are we on that route with MS?
We are.
Okay.
We're definitely getting closer. Today, we don't have a cure, unfortunately. It's a progressive, chronic, debilitating illness. And the way that we treat it is, if you think about what's happening, the immune system's volume is turned way up, right? So we turn that volume back down by giving disease-modifying therapies, therapies that modulate the immune system, therapies that suppress the immune system, like steroids, therapies that treat the symptoms, like spasms and problems with bladder and bowel function. We can even take out your plasma, which is the liquid part of your blood that has the antibodies that are attacking the nerves, and put it back in without the antibody. So there's a whole bunch of different therapies, but the cure is still a little ways away, because that means regenerating nervous system tissue. And one thing we haven't gotten good at yet is figuring out how to repair damaged cells. And if the nerve cells get damaged, how do we fix those? And so stem cells and such are where we're thinking about how we might have cures.
Is it painful? Are they in a lot of pain?
Depending on which nerve, Sam, it can be incredibly painful.
Wow.
Because think about what our nerves do. Every single thing in our body, right? They make us feel, they make us move. And so if it's the sensation nerves, if it's the pain nerves, people can get neuropathies with multiple sclerosis.
Just constant chronic pain.
I had a friend in medical school who woke up one day, couldn't see out of her right eye. And it was right after a stressful exam that we had. And stress can often be a trigger for many women for the first flare. She just went blind in the right eye.
Good Lord.
And that was her presenting symptom. So you can imagine these poor women, and I'm saying women because MS affects more women than men, but men can get it too. But the toll that it can take on your everyday life.
Wow. Okay, well, let's switch gears for a second, because there's a new study out about marijuana and its links to strokes and heart attacks. So does this just apply to daily users, people who are watching Friday?
A lot.
Constantly.
We're learning marijuana is tobacco 2.0. So we used to think it's completely sort of benign, and partly that was we didn't know, right? Because nobody was allowed to use it. Now in states like Colorado where it's legal, we're getting data, and data is telling us that marijuana activates inflammation, it activates the blood vessels, and it is linked to stroke and heart disease. Wow. And it's not just daily use, but even kind of infrequent use. Now the more you use, the more likely you are to have risk. So it's a dose-dependent relationship, but it doesn't have to be, just daily use. Even people using it recreationally are at risk.
And it doesn't matter how you use it, right?
And that's the other key. We used to think smoking is the worst, which I do think it still is, because it activates the inflammation, but even edibles can activate the nervous system in the same way, have the same sort of stimulant effects and cardiovascular effects. And so you want to be careful, because even edible use can be associated with heart disease. And it's in people who've never had heart disease before, young, healthy people.
Good
so
Lord.
we're not just talking about the old people with pre-existing conditions.
Dr. Coley with the bummer news.
Bummer segment.
We can't have
I didn't
anything.
ask any of you guys up here because I don't want to put you on the spot, but later on we'll talk about it.
Yes.
DBL Nation, follow Dr. Coley on social media at Pyle Coley MD. Also be sure to subscribe to her YouTube page. Plus check out her podcast, Heart of Medicine, wherever you listen to your podcast. Thank you again, Dr. Coley. We appreciate you. We'll be right back.